everybody. I'm Dr. David Alfonso, board certified plastic surgeon specializing in cosmetic surgery, coming to you from the Bankston Center for Aesthetic Surgery and New Vista Surgery Center. I'd like to welcome all of you to our informational webinar on facial rejuvenation surgery. So the term facial rejuvenation is very broad, and really what it refers to is the options to do surgery on various parts of the face, starting from really the hairline, eyebrows, all the way down to the neck area. And facial rejuvenation is the term that we use in order to kind of describe surgical plans that can improve shape, contour, make people look a little bit more youthful and rested. We break it down specifically in patients' consults for targeted areas such as upper and lower eyelids with the eyebrows, or face and neck, and sometimes even as well ears and rhinoplasty or nose shaping surgery. So it's a very broad term, but we really narrow it down based upon patients' goals and desires. So the term scarless lower lid blepharoplasty refers to the ability for the surgeon to go in and remove fat, which is causing some of the puffiness of the lower eyelids, through the inside of the eyelid, where a scar is not visible to the outside. It's called the conjunctival. The medical term is called transconjunctival lower lid blepharoplasty. That's a big mouthful, but basically it means going in through the inside of the eyelid and removing the fat while leaving the outside part, or the skin, untouched with the scar. Oftentimes that is combined with some laser resurfacing to the skin, which can be done at the same time. Upper and lower lid blepharoplasties are very frequently combined together because realistically most patients who have concerns regarding the uppers tend to have issues with the lowers and vice versa. The surgery for the upper lids leaves a scar that's strategically designed to rest in the nice crease of our upper eyelids, so that when you've healed and you're talking to someone, it's very difficult to pick up on the scar. The goal is to make the upper eyelid less puffy and heavy, to look more refreshed and more youthful in that area. And most patients will opt to do rejuvenation or surgery of the upper eyelids in addition to the lower eyelids, because it makes sense that you want the whole, what we call periorbital area, to look more youthful and match from the uppers to the lowers. Candidates who are excellent potential surgical candidates for this procedure are those patients who don't have a lot of loose skin, tend to be younger, just with some puffy bags under their eyes, that don't necessarily need skin removed, just the internal fat repositioning and or removal. So there's a lot of questions regarding terminology in facelift. So you may see the term short scar facelift. It's a term I use for patients, and that refers to making an incision in the front of the ear and the hairline, and then in the back of the ear, but stopping behind the ear. Traditionally, we would extend it, and we still do in certain patients, to the back part and the hairline. A short scar would stop behind the ear, so it makes it easier for women to pull their hair back into a tight ponytail and not have a scar that's healing and be visible to other people. The surgery still accomplishes the goals of elevating what we call the jowl, which is the area of fullness near the chin, and some of the upper neck area. In patients who have more skin looseness, both in the middle as well as the side, and heavier jowling, oftentimes they're not considered great candidates for the short scar, and we do what's called the traditional approach, where the incision does extend behind the ear onto what we call the mastoid area and then near the hair. Most women, if they have long hair, can cover that during the healing phase to be easily camouflaged. So the term rhinoplasty literally means nose reshaping, and it's a relatively common and popular procedure. Patients who are considered good candidates for the surgery are obviously in good health without major significant airway or breathing problems, and are looking to come in and have improvement in the shape of the nose. The most common areas that I tend to see and I tend to fix are what we call bumps or humps on the nose, on the profile, as well as the tip area. And what that does is it allows me to create a more smooth contour, so when patients are being looked at from their side or their profile, they're happier with a straighter, more relaxed, what we call dorsum. And then the tip area, adjust the tip to make it a little bit less wide. Many patients come in with what we call boxy or bulbous tips, and doing surgery on the tip as part of the rhinoplasty allows me to reshape that and create a little bit more youthful or less wide-looking nose. In addition, there are cases where I remove a little bit of tissue to help narrow the nostrils and also narrow the bony part of the nose. All of these work in conjunction with one another in the right patient to create a very natural, not over-operated or fake look in patients. One of the more exciting topics that we've had recently is the advent of Lipo AI, which is a laser-based liposuction system. The real benefits in the face come in what we call the submental area. So some patients come in and aren't candidates or don't want or need a full facelift and just need some liposuction of what we call the submental area or the neck. And what that does is with the Lipo AI, it allows the laser to create heat energy under the tissue to get better skin tightening and retraction. In addition to that, fat is removed through 3 small incisions, earlobe, chin, and the other earlobe. What that allows me to do as a surgeon is sculpt the neck more and create a better jawline from the profile view, as well as tightening of the skin and removal of fat in the front view. The Lipo AI has been a great adjunct in order to get really good results by getting some additional tissue tightening and better contour due to the heat energy produced with the laser in surgery. So some of the common concerns that I hear in talking to patients are, how am I going to look and what's my recovery going to be like? Okay, so facial rejuvenation surgery, typically the recovery is something where I tell patients you're going to feel better than you look, meaning that it's normal to have some swelling and some bruising. With the technology that I utilize here in terms of using medication that help minimize bruising, patients are up and out of the house a lot sooner and quicker than they would anticipate. But there are restrictions on bending, lifting, and heavy activities. The goal is that patients feel comfortable being out of the house within somewhere between 10 to 12 days and seeing people out in public and feeling pretty comfortable that their swelling and bruising is on the downslope. So one of the big concerns is, how am I going to look after surgery, both early on as well as long term? The goal here for my patients is, of course, to achieve a natural shape that looks like you, just softer lines and a little bit better contour. That's really what it is. Patients aren't going to look different in terms of they look like a different person. And so we talk to them and educate them about the techniques. For facelifts, typically we utilize tissues in the deeper plane, called the deep plane, where I lift up the muscles of the face, because you really want to avoid putting any tight tension on the skin. Some skin is removed as part of a facelift, but it's not really the main mechanism of tightening the face. That is the deeper tissue or the muscle layer of the face. That gives patients a more natural long-term outcome, but also better longevity of their result, lasting somewhere between 7 to 10 years. Ultimately, we talk to patients about what to expect. Of course, in the beginning, for the first 7 to 10 days, patients will feel a little tight, they look a little bit tight, but that's the normal course of healing from a cosmetic surgery on the face. Very quickly, with the techniques that we use, patients feel very comfortable and they start to look natural, and the swelling starts to go away as early as about 12 to 14 days. So typically after a facial rejuvenation surgery, whether it's eyes or face or a combination of the two, patients will leave with some gauze and some bandages on their face, and they go home that day. It's an outpatient procedure. For our facelifts, we like to see them back the next day to get the dressing removed so I can look at everything, make sure nothing is looking worrisome. They also get a hair wash here in our nice hair wash room, which really is great for them because it allows them to feel better about cleaning their hair and not having to worry about doing that while they're at home. So it's normal to go home with some gauze. We give instructions on what to do, what not to do. Most cases also we tell patients to do some icing, especially for their eyelids. That helps with swelling for the first 2 to 3 days. And it's really just getting up and doing basic normal activities at home. But generally gauze and bandages are part of the recovery process, but only for the first 2 to 3 days. After that, most patients are not restricted in terms of having gauze on their face. So the timing for surgery is really dependent on a couple things. Sometimes patients will say, oh, I'm too old or I'm too young. Reality is chronological age is only one component. Patients are looking to do surgery sooner rather than later because the results, although noticeable, are not quite as dramatic and seem more natural. It's almost what they've termed preventative facial surgery. Patients oftentimes will come in and will talk with me as a surgeon to find out if they're good candidates for surgery. During the exam and the consultation, we talk about the pros and cons of doing surgery now versus in the future. And if I don't feel a patient is going to get a very good natural result from the surgery, I'll tell them that it's better to wait and maybe perhaps do some non-surgical things in the interim time period. But everyone is a unique individual with different anatomy and skin quality. So that's why really customizing a treatment plan is the ultimate best option. And that's what we do for you in the consultation. So plan for surgery is again to help reduce some of the fullness on the upper part of the nose, what we call the nasal dorsum, which is part bone, part cartilage. Also take some tissue from the tip area, bring that together to be a little less wide, more refined. Overall, that's going to give the appearance that the nose is narrower with a more sleek shape to this area and get a little bit of an upturn to the nasal tip area. I'd like to thank all of you for attending the webinar today. Hopefully it was informative and helped to clarify some concepts, misconceptions, and questions you may have about facial cosmetic surgery. Hi, everybody. I hope that you found the presentation enjoyable. And we tried to kind of get a cross-sampling of a variety of surgical procedures to give an idea about the types of procedures we do, locations of scars, as well as results. So I appreciate you devoting some time to learn more about facial rejuvenation procedure. So I'd like to get right into the questions. We already have patients that have submitted some. The first question that we had was, what's the best approach to address loss of facial volume and sagging of the mid and lower face due to significant weight loss? surgical or filler? Well, typically, if you describe sagging to me as a surgeon, sagging means tissue that's fallen down. And really, the best way to improve that, and really the only way, is to lift it with the surgical approach. So that's typically a face and neck lift. The loss of volume is improved by the technique of the facelift, but also times where we will take fat from your abdominal area and use that fat to inject into the face, sometimes into the cheeks, in patients who are kind of thin and hollow and have lost volume due to their weight loss. So those are the typical approaches that I would take for a patient who has a history of weight loss and has some sagging skin, but also loss of volume. So we want to put fat strategically back in where we think it's going to give good youthful contour, and then lift by doing a face and neck lift. Another question here, do you work on lip lines at all? So lip lines are definitely ones that are very common and patients really dislike them. We used to call them smoker's lines. But reality is that most patients these days don't smoke, and you can still get these what we call vertically oriented lines around the mouth. They can be challenging in some patients. I found that typically the best results I achieve with treatment is through laser resurfacing. Oftentimes that is combined with a facelift surgery. It's called perioral, which refers to this area pretty much above and below the lips. And the laser is very effective at helping to soften some of those lines. That's done oftentimes at the end of when I do a facelift, when patients are still under anesthesia and very comfortable and unaware of what's going on. So typically the fine lines above and below the lips are best treated with lasers. Sometimes we can do fillers as well, but I would recommend starting with laser resurfacing because I think you're going to get the most bang for your buck from that process. Another question, is there a major price difference between a short and long scar facelift? There isn't really a major price difference per se. The procedures are slightly different and one takes longer than the other. So the way that our quotes are derived they're based on the time that's required for me to be in surgery doing the procedure. So a surgery that takes longer is naturally going to be a little bit more expensive because there's more anesthetic time and there's more facility time. But ultimately, what I tell patients is we don't want to focus on shortcuts because of shorter scars if you're not a candidate for it, or shorter surgeries if you're not a candidate for it. Because reality is we want to hit a home run and get a great result for you when you're in the OR. And when I typically see a patient, I'll recommend what I feel will give them the best result possible that we can achieve, and obviously taking into consideration their goals and their tissues. How long does short scar facelift incisions fully heal? So healing is relatively quick on the face. The nice thing is that most women can wear, unless their hair is very crop short, you can wear your hair down to cover the incisions, which tend to be located in front of the ear and then potentially behind. By about 6 weeks, the strength of the incision is very significant. Now, that doesn't mean you can't go out of the house before 6 weeks, obviously. But by 6 weeks, there's almost no restrictions for patients when it comes to doing physical activity. So going to the gym, engaging in sports, typically swimming and putting your head underwater. So the scars tend to heal very quickly on the face. They tend to heal very well. Some patients will come in and be concerned and say, look at this scar on my back or on my knee. I don't like how it healed. I'm concerned that my face will heal that way. And for the most part, I would say that's not a real accurate comparison because scars on different parts of the body just heal differently naturally. And facelift and eyelid scars, as well as rhinoplasty scars, tend to be the best scars on the body. And facial scars tend to be the easiest to hide and also the quickest to be camouflaged in other areas. We try and place them strategically so that even when they are healing, they don't stand out compared to other areas. Another question, does the lower facelift take care of the loose neck skin? The answer to that is yes. When you have skin that's loose and it gets further and further down the neck, typically think of it this way. The further the loose skin goes here, the longer the scar has to be in the back. And that's just because we want to pull and have that vector. So patients who are candidates for the short scar typically have very little issues in the middle to lower neck. In men and women who have a lot of loose skin here that goes all the way down to almost the Adam's apple area, those patients typically are going to be candidates for what we would call a traditional facelift, where the scar would go in front and behind the ear and potentially here in the chin crease below the chin. And the reason is because it requires more work for me, the surgeon, to tighten up the muscle and get rid of the extra skin. So big question, this is a common one that patients ask, how long does a facelift last? And the reality is that it's a seemingly simple question, but there's a lot that goes into that. I would summarize it to say that 10 years after a facelift, you will look different at year 8, 9 than you would look at year 1, certainly, because aging still continues. But what I like to tell patients is that at 10 years out from the surgery, you're going to look more youthful than you did the day before you had your surgery. In fact, I looked at a patient not too long ago who was in our office many years ago, and I did a facelift on her, and we found photos of her way back before from another procedure about 12 years ago. And she looked very similar when it came to the shape and the contour of the face a year and a half out from her facelift than she did 12 years ago. So think of a facial procedure like a facelift or a neck lift of kind of turning back the timer. Aging still continues, so we always recommend for patients that you continue to use good skincare products and get treatments like lasers and hydrofacials. If you don't do those, it's a good thing to start both before and then after your facelift, because it's going to make your investment in your surgery last longer and look better. The key things are not to avoid any tobacco or nicotine, avoid a lot of direct sun. Those are the two biggest factors that prematurely age facial skin. Also, we want patients to be relatively stable in weight, because if you have surgery and you go ahead and lose 30 pounds or 25 or even more pounds, that can change the neck and the looseness in that area. So ideally, surgeries should last to make you look good for at least 10 years out. But again, it's all about if you're taking care of your result as well. So that's what we educate patients about here. And the beauty of our practice is that we have great surgical options. And then for patients after their surgery, we have great non-surgical options when we would consider more of the maintenance phase of the recovery. All right, here's a question about nose surgery. As a person gets older and their tip of the nose begins to droop, can you just lift the tip? There are patients who are good candidates for what we'd call a tip rhinoplasty, which is really just focusing on the tip area. Aging does occur in the nose, as you would imagine, just like anywhere on the face, although noses tend to be probably some of the longest lasting results in cosmetic surgery because they're so much less dependent on sun exposure, smoking, and weight loss and loss of volume as we get older. Nevertheless, they will change over time. So in patients who are good candidates for what we call a tip rhinoplasty, then I can evaluate them and we can do surgery just focusing on the tip if we don't need to do other areas of contouring. Another question here. When will the bumpiness along the back of the hairline smooth? So the scars tend to heal fairly quickly, as I discussed earlier. The back of the ear tends to take a little more time from a healing perspective than the front. And that's because the skin here is much thinner and tends to have very little tension here. The back here, if you can feel, there's a bone here we call the mastoid bone. And that can be an area where the scar is a little bit thicker in the beginning. So I tell patients the scars in the front are typically ahead of the scars in the back, but the scars in the back will catch up. And so they do smooth out. It takes somewhere up to about 6 to 9 months per se. Facelifts tend to be at their final result. Typically, we would always say at a year, but reality is probably even earlier than a year in the front of the ear, probably close to 9 to 12 months to get complete smoothing in the back of the ear. And there are things we can do during your healing after surgery. If you have concerns and the scar looks a little thicker than we like, there are a lot of options such as steroid injections and silicone gel treatments. And we go over all that with patients when they're back here following up after the surgery. The question came to a patient who has some medical problems, stable labs, be able to get something invasive like an upper lower bleph without a lift as well. So the reality is that upper and lower eyelid surgery can be done under relatively lighter sedation. The upper eyelids as a standalone procedure can be done under complete local. That takes particular person who's on board with that, but it can be done under local where you don't go to sleep at all. In my particular practice, doing the lower eyelids is just a little bit more intricate. It's a little bit more sensitive to patients, and it's really not able to be performed under anything except pretty much anesthesia, either heavy sedation or general. So in patients who are concerned with their upper eyelids only, that can be done in the right patient with you completely awake, just numbed up. Other patients will choose to do it with just some lighter sedation, kind of like if you've had wisdom teeth removal or a colonoscopy. As you get into more involved procedures, facelifts and neck lifts, those are typically done under general anesthesia because it's safer for the patient to have their airway protected, to monitor all the vital signs. And most of those surgeries take upwards of 2 to 2.5 hours on up. And that's challenging for someone to sit still and be comfortable for them that amount of time. So it benefits the surgeon and the patient when we get into longer procedures for patients to be under what we call general anesthesia. Another question about lip fillers. Lip fillers don't seem to work for me because my lips are so thin and turn in. Is there a lip lift or something to bring the lift up? That's a great question, and that is true. So there is a procedure called a lip lift. It's not a lip flip. That's a different procedure that uses Botox. A lip lift removes skin from the upper lip, which tends to elongate as men and women get older, and it hides the scar right in the crease of the nose. What that does is it allows people to see more visibility of the pink part of your lip, or what we call the vermilion border. That gives the appearance that your lips are a little fuller because they've been lifted up a little bit, only the upper lip. And that is done without utilizing any fillers or injections into the lip itself. So for patients who have a very thin upper lip and have a longer distance from their nose down to the top of the lip, the lip lift procedure is a very effective one. As a standalone, that procedure also can be done with either light sedation or even under complete local anesthetic only, where patients are wide awake, they're just numbed up and very comfortable. All right. One question was about insurance. Does insurance cover any of these procedures? Well, the answer is no. Insurance does not cover these procedures. They are all deemed cosmetic. Some patients will have such profound hooding of their eyelids that sometimes insurance can cover the upper lid portion of that procedure, although those are harder and harder based upon insurance coverage for that. So reality is anything dealing with the lower eyelids, the face, the nose, all these things are considered cosmetic procedures. Here at our practice, we don't participate with any insurance. So reality is it's best to go into these procedures and consultations thinking that basically these are all procedures that are designed to improve the appearance of the face and well as in part better in terms of self-esteem and that nature, but they're all considered cosmetic and really not covered by insurance. All right, another question. Someone's interested in upper and lower blepharoplasty, also significant volume loss. Oftentimes we can do some volume transfer around the eyelids, but it's a very particularly sensitive area. And so many times I'm reluctant to inject anything around the eye, whether it's fat or certainly fillers. It can be done, but it's a very unique process. And the best way to go about doing this is to come in for a consultation, because sometimes patients feel like they're losing volume, but really it's just that they have prominence of the fat and hollowing below where the area is prominent. By removing some of that fat, it allows us to balance out the area and oftentimes can improve the shape and the volume there without adding necessarily volume. Around the eyelid, the skin, as you can see and you can just feel on yourself, is extremely thin. So you have to be very cautious when you're doing any type of adding volume that you don't inject anything that could become too superficial and create a lump or bump that can either be visible or palpable. So that's where the consultation comes in and has its greatest value. You'll meet here in the office with me. We'll go over your goals and what you're wanting to accomplish with surgery. And I can also establish whether or not you're a good candidate for the procedure, and then what that procedure would cost and the recovery time that's involved. So as a reminder, you will be receiving a text message at the end of the event. Please reply with FACE, F-A-C-E, to be contacted for a consultation. We are providing a special benefit for members of patients who participated in this webinar, and that we are reducing the consultation fee if you attended by 50%. So it's a great opportunity for you to come in. If you've been in our office before, we'd love to have you back, talk about some of the new things we have available. If you've never been in, it's a great opportunity for you to come and learn about all of the great things we do from a surgical perspective, as well as some non-surgical perspectives as well, that I'm sure we can find a solution and a plan to really get you on the path to feeling more comfortable and improving your kind of self-esteem regarding your facial rejuvenation process. One more question here that popped up. How long do you need a neckband at night after a facelift? So the neckband is a compression garment. We typically give that to patients after a neck lift or liposuction. We like you to wear that for the first week, day, and most of the day, and definitely at night when you sleep. Typically, week 2 is mostly at night when you're sleeping. After week 2, you can be out and about without it, certainly during the day for parts of the day, and at night you can start to sleep without it. Patients do find that it provides some comfort. It does help with swelling, and it really does a good job of helping to promote the skin to kind of heal back into the exact position that we would like it to be. So I'd like to thank all of you for participating. We appreciate your time, and hopefully this was very informative and informal. Again, I would recommend following up. We have our, you'll be receiving a text message, and you have the opportunity to schedule a consultation at a special price discount as a member of the webinar. For those patients who were unable to view it today, it will be on YouTube, and we will also look at the potential of emailing a link to participants if you've included your email, if you reach out and were not able to watch it, so you can see the full webinar in its entirety. In that way, you can learn about the procedures as well as see the before and afters, which are very helpful. And I would also recommend for anyone interested too, look at our website. It's a great resource to look at before and after photographs. You saw a number of them today. I have a lot of photos of patients as well as my partners of before and afters for all types of facial cosmetic procedures. So in closing, I'd like to thank you all again for participating, and I hope to see as many of you as we can here in our office in the next few weeks. Thank you and have a great night.